All right, welcome to the Radon Information Session for the communities of RDOS, Osoyoos, and Penticton. Welcome, and feel free to ask questions as we go through. Take Action on Radon is proud to unite members from across Canada, which encompass the traditional territory of many First Nation, Métis people, and Inuit whose ancestral footsteps and rights extend beyond our colonial boundaries that exist today. We respectfully honor these people's rights, history, and our relationship with this land. So as you see on the screen, I will go through some of the basics of radon, and then at the end I will take time to go through specifics for the Radon Test Kit Challenge of where you can pick up the kit and just how that program works. And then it'll take about half an hour, and then we'll take time for questions. So feel free to put any questions that you have in the chat or the Q&A, and we'll get through those at the end. So radon is a gas, and it is linked to lung cancer. It is the leading cause of lung cancer in non-smokers, and it is a significant contributing factor for those who smoke. Anybody that has ever smoked or is a current smoker, the combined risk of radon and the history of smoking can significantly increase that risk. So radon is a gas, it's in the air around us, and as we breathe it in, it decays and it releases energy, and it can do damage to the cell tissue, and that damage can initiate lung cancer. So the higher the risk, higher the amount of radon that you're exposed to over a duration of time can increase the risk, and I'll talk a little bit more about that in a minute. Now, radon is a known human carcinogen. So it has been declared this by the IR carcinogen, so it's a Class A carcinogen. And the World Health Organization has also developed a guideline for nations to deal with radon. And there are other, countries and nations around the world that have also set guidelines for their citizens to deal with radon. Now, radon is originally was found to be a risk in minors, so at really high levels. And then there was residential case studies that were done all across our country. So there were some in your area actually done probably in the 80s and 90s. So some of you may have encountered this previously. And a lot of that research that was done across our country in the 80s and 90s was rolled up together with other research that was done across the world to show that there was a concrete connection between elevated exposure to radon at lower levels and sort of in residences where they previously had been just concerned with the uranium miners. But that research showed that it was a concern in homes, and that led Health Canada to reduce its guideline in 2007. Now, I talked about the fact that there is a combined risk. So somebody who is exposed to a lifetime of elevated radon is a risk of 1 in 20 for developing lung cancer, so about a 5% risk. Somebody who is exposed to both elevated radon and has a smoking history, their risk is 1 in 3, and so a 33% risk. So you can see how it's a significant increase. If you have just smoking risk without the radon, it's about a 1 in 5 risk. So you can see how it changes there. Now, I mentioned the fact that the risk from radon increases over a duration of time. And so these percentages are based on lifetime exposures to radon, but you can see how there isn't no risk below the 200 level. It just starts to go down. And so Health Canada has set our guideline level at 200 becquerels to basically say that if everybody in the country could test and reduce their list to under 200, it would significantly reduce the number of lung cancers that we're seeing. But the recommendation is that when you do take actions to reduce it, that you reduce it to as low as possible. And that really is because 199 doesn't negate the risk. It's a linear, so it continues to decrease as you go down. And for somebody that is, in the 100 to 200 range, or below that, you may want to still consider taking action to reduce, especially if you have combined risk factors, like if you've got smoking or other lung health issues, then you may want to reduce levels at a lower level than what Health Canada's recommendation is. Now, radon comes from our soil. Uranium is a rock, and it's found in our soil all across the country. It is a solid, so it stays in the soil, but it is radioactive, which means it spontaneously decays and changes. And so it then can move up out of the soil and then it's in the air around us. But any building that has contact with the ground can have elevated levels because the radon gas can come in through openings such as sump pits or cracks or crawl spaces, and then it doesn't escape at the same rate. So it comes in at an increased concentration, providing that increased risk. So generally, we consider that the levels are higher in the basement, but the air does move around. And so it does enter through the basement, but in homes that are forced air gas or heat, the air then does move around and circulate. And so the levels can be quite even all the way throughout. Now, it's not just homes that it can go into. Now, we focus on testing homes here, but it can be in any building. So we do encourage, all schools, workplaces should also test for radon. Really, any building that has contact with the ground. Okay, and so that's a little bit of the background of the health risks. And so now I'll just go into how we test for radon. Now, it is easy to test for it, but there are some things that we put in place for guidelines to make sure that you're testing for it, to give yourself a good picture of whether or not your levels should be reduced. And radon is, because radon is a gas, the levels can change due to air pressure differences. So typically, radon is drawn in from the soil into our buildings because the soil below our homes or buildings is in high pressure, and the air inside our buildings is at a lower pressure compared to the soil below. And so that difference in pressure draws the air into our buildings. But this can come in at a different rate. So obviously, first there needs to be a source in that subslab space, but then the amount of gas that's drawn in can be impacted by things that can affect these pressures. So outside factors could include weather. So things like, air pressure systems, low air pressure systems that come in that change the weather, wind, temperature changes, those can have an impact on how much radon is coming in. For example, we often assume that when it's cold outside and the ground is quite cold and your home is quite warm, then this is going to increase the amount of gas that's coming in because there's a greater pressure differential. Wind can also change it, but it can kind of change it in different ways. So it's a little bit unpredictable whether it can increase or decrease the levels. But then there's other external factors that can decrease or then can change the amount of radon coming in, such as, changes in fissure ground from earthquakes or major construction, things like that, that can change the fissures or the cracks in the ground, can change the amount of radon that comes in. And then there's also factors within your building that can change the amount of soil gas that's coming into your building. So anything that can change that pressure differential. So for instance, if you turn on your kitchen exhaust fan and you're venting the air outside, but there's no makeup air to replace it, this can depressurize your building envelope. And then the building sort of is trying to make up that air somehow. And so it will usually draw it in from wherever it can get it. So if you don't have leaks on the top part of your house, it'll draw it in from the contact with the soil. Other fixtures in our homes, such as bathroom fans, dryers, things like that, can also have a similar impact. And so because of this, the levels can change throughout time. And so Health Canada recommends that we test for 91 days because that will give you an estimate of your annual average. and it will smooth out the ups and downs so that you can understand what your annual or your average exposure is. Now, for this program, we use alpha track tests, and they are reliable, one-time use, and they are accurate. And we'll talk a little bit about the quality assurance that we do with these devices to make sure that they are accurate. But when you get them, they will come in a sealed package. You just need to open up the package, and so that it's a clear package. Just cut open the clear package, take out the little plastic puck, and put them in place, and basically they're on. And when these devices are in your home, they have a little piece of plastic inside that black case. So you don't want to open the black case, but just so that you know there is something in there. And there are little cracks in that case that allow the air to move in and out. And then this will measure the amount of radon that is decaying. So there's actually a bulletproof plastic that's inside these detectors that when the radon decays and releases that energy, it will put a mark on the detector. And then when we ship these back to the lab will analyze it, and it will come up with the average amount during the time that it's in your home. So it's important for us to get the date that you start it and set it up in your home, and then also the date when you drop it back at the drop-off location, because that will help the lab with calculating what your average radon level was throughout that time. All right, and I've got Dr. Anne-Marie Nicol is joining me from BC CDC and SFU, and she's going to share a little bit about a couple programs that are happening in BC. Hey, Anne-Marie.
Hey, Pam. Thank you very much, and I apologize for the delay. I'm just getting back from teaching. I am pleased to tell you that BC is actually one of the provinces that has been doing the most on radon for the last while. And what you're looking at here is a publicly available map that we have at the BC CDC. It is based on data that's been collected for a while in this province. As Pam noted, since the 90s, they've been doing radon testing. And what we've learned is that there are parts of the province where radon levels tend to be higher than others, even though there's uranium dust and small particles in soils across Canada. We've learned that there are parts of this province in particular where levels are quite high. So at the BC Centre for Disease Control, we brought this data together and we've made it into a publicly accessible map that is optimized for using on a cell phone. And if you go to this URL, you can dial up the map, and up here on the corner or the top left, you can see where it says local health area. You can also organize it by municipality. And the information tells you not only the proportion of homes over 200, so the darker the color here, the higher the likelihood that a home will test above the guideline, but it also lets you know how many people have tested in a community. So if you have a community of 10,000 people and you've only had 34 homes test, you have a better understanding that that's not necessarily representative. But there are some parts like Lake Country or parts of areas near Kelowna where we've had thousands of people test. And that's when we're starting to have more certainty. So the more that people test in BC, the better our understanding is of where the radon levels are. You can't tell exactly, though, where houses are due to issues of privacy and confidentiality. We don't give very granular levels, but the close enough is a municipality or a local health unit, depending on where you are in BC. So please go and visit the map. Encourage other people to go in and look at the map. The gray means that we haven't tested there yet at all. We just don't have any data. So we're working on it slowly and surely over time through programs like this. We are able to get a better understanding of where priority areas are in British Columbia. And you may notice that where you are right now is already trending towards a darker orangey red color. And that's why we're here this evening, is we've had some indication that in the RDOS, there are communities with elevated levels of radon. Next, please, Pam. The other impressive thing I can offer this evening, which they don't have anywhere else in Canada, is that radon gas is a potent lung carcinogen. And if you are a smoker, you can access what's known as a low-dose CT screen. And that allows us to understand whether or not people have the beginning nodules that can lead to lung cancer. And that's actually the thing that the sooner you catch lung cancer, the more likely you are to be able to prevent people from dying or still being alive in 5 years. Lung cancer remains one of our least survivable cancers, like pancreatic cancer. And unfortunately, 30% of lung cancer cases in BC now, 30% have never smoked. So that's part of why programs like this are becoming more and more important. And traditionally, the only way you could visit this fancy machine is if you've been a heavy smoker. And what it will do is tell you what your risks are for developing cancer. What we're trying to do in BC is change that. So if you've been exposed to other lung carcinogens for a while, you are able to access this for free. I have done this myself. It's a painless test. You just go through. It takes about 5 minutes once you actually get in. It takes about 5 minutes, and it allows you to have with some certainty whether or not there's growth or nodules in your lungs. It's a pilot. It's only offered in Kelowna and Vancouver, and we have an opportunity now to have a free lung health check again if you're not a smoker. If you're a heavy smoker and you haven't done this yet, I strongly encourage you to get a low dose CT. Again, it is the one thing that will help increase your survivorship if you do indeed develop lung cancer. So when you're finished testing your home, if it's 800 becquerels or above, or if your workplace is, I strongly encourage you to reach out back to us. We'll provide you with the information, or you can go there directly if you want. This has been recorded and will be available to people to look afterwards, but it's through BC Cancer. It's called the Lung Health Study, and there's a phone number there. And I'm happy to answer questions after. Do you want me to keep going, Pam, or would you like over? Okay, so what is it about this 200 level, and why do we organize our maps that way? That's because the government of Canada recommends that if your levels are above 200 becquerels per meters cubed, and that's how we measure radon, that you need to make a change to reduce levels. Now that looks like an and or number, as Pam had noted. Is it under or is it over? But the reality is it's actually a linear dose response relationship. So the more radon that you're exposed to and the longer that you're exposed to it, actually the worse or the greater the likelihood that you will develop lung cancer. In Canada, when the government decided to make this regulatory limit, which was in the 80s, they took into account the fact that we actually have a fair bit of uranium across the country, and it is present in soils all across the country. So they decided to set the level at what they felt was 200, which was achievable for Canadians. In Europe, it's 100. And in the United States, it's 150. So we are not as health protective as our neighbors. And so sometimes people choose to remediate their homes if they are above 150, recognizing that this is the regulatory limit for our neighbors to the south, or even between 100 and 200, because levels can fluctuate. And if you do changes to your home, like energy retrofits or something where you're changing the way that air moves through a house and you're closing your house up, you're going to trap gases inside your house. So between 100 and 200, I would be watchful waiting, for example, but anything over 200 is where the government recommends. And that's because there's about a doubling of the relative risk of developing lung cancer after 200 becquerels. So if you wanted to find somebody to help you test your home or fix your home, and because it's an odorless, colorless, tasteless gas, and you can't tell if it's in your house or not, it's really important to make sure that you hire someone that's certified in order to do this work for you. So we have in Canada a national certification program to ensure that the people who come to test and or remediate your home have actually passed all the appropriate tests and are basically licensed to do the work that they need to do. So if you want to find somebody near you who can so you're testing on your own right now, and it's actually quite easy to test. So what you're doing now is the most accurate way of testing. But if you wanted to reach out and find somebody, and luckily in the Okanagan, because there are levels that are relatively high in fairly populated areas, there are people who do radon mitigation. This isn't the same across the country. Parts of the Maritimes or places where there's people are fewer and farther between. So you happen to live in a good region where there are people who know how to fix homes and they know how to test them. Next, please. So what to do if your level is above the 200 guideline, a radon mitigation system is considered the most effective way to reduce radon. It's a simple thing to maintain, and I'm going to hand it back over to Pam because I'm the nerd and she's the building science person, and she's going to explain to you what a radon mitigation system is in much better detail than I would.
Sounds good. Thanks, Anne-Marie. So it is a simple concept. It consists of a pipe that provides a pathway for the gas to go from beneath your home up and outside of your home. So if you've got a concrete floor in your basement, then the pipe is going to go down through your concrete floor into that subslab space. And then this little area that sort of looks like a tire is really just an open area, void space. And so it will have some area so that this fan can then move a little bit of air up and through the pipe system, and then the air gets discharged outside. We've done research on this to show that it's very effective. It can reduce even high levels to quite low. We talk about 90% effectiveness, but really in numbers, if you've got a home that tests above 2000, it can reduce levels to below 100. If you test 400, then it can reduce levels to under 100. So it is effective in reducing low levels. It does need to be properly installed. So as Anne-Marie said, we do have a certification program in Canada. So we do recommend that you hire somebody that's been trained through CNRPP. A couple key things to consider when somebody comes into your home to install this system. They should make sure that the footprint of your home is well sealed. So this concrete floor should be properly sealed. If you don't have a concrete floor, maybe you have a crawl space with a membrane, that should be well sealed. Because ideally when it's well sealed, it works more efficiently. But also, if it's not properly sealed, then it can be drawing conditioned air down and then out. And so it can mean, you're losing air that you've just warmed. But also, if you do have gas-powered appliances or things that can backdraft, it can also be a concern. So it does need to be properly installed. And then this fan should be properly sized for your home. So a professional will come in and drill a couple holes and do some air pressure tests and then some calculations. And that will help them determine the amount of air that they need to move through the system. And ideally, they want it to be just large enough for the worst case scenario of your home so that it's not sucking the air out, but it's just easing the air up and out. That way it's more efficient. It can be lower energy of fan and that sort of thing. So here's a couple pictures of what it might look like. This picture on my right has a little YouTube manometer. So it should also have a system gauge to let you know that the fan is still working. And so this YouTube is just a little tube of liquid, and then when the fan is working, the liquid is just a little bit off center. And so that shows that it's drawing air through it. If you were to unplug the fan, then you would notice that the levels would go back even. And so, in the future, if the fan stopped working or got plugged or something, that would give you an indication that the fan wasn't working. Ideally, this fan can be really quiet, so sometimes it can be really hard to hear. This one has a plug-in monitor on it. So this one has an audible alarm. When the fan stops working, the pressures go down, then it'll just give you an audible indication that the fan has stopped. Another thing that we wanted to let you know about is that if you do have high levels when you test and you need to install a mitigation system, the Canadian Lung Association has a radon mitigation grant program. This program is available to all across the country, but it does have a qualification. So first, in order to apply, you need a long-term test report, so such as what you'll get here with this program. And then you also need a quote from a CNRPP professional, and you need to apply prior to the work getting done. And then you also need to qualify. And so you need to show proof of qualification, and that would be one of two ways. So either you are low under the median income for the province, and so you do need to upload proof of income, or if you have somebody in the home that has a lung cancer diagnosis, then you don't need to qualify based on income, you would qualify based on the lung cancer diagnosis. And so you can find information on the Canadian Lung Association website. The grant is for about $1,500. And again, you need to apply before you start the mitigation work. So that's important to know up front, which is why we like to tell you ahead of time. The other thing to note is that in BC, there is radon measures included in the building code. So these have been in the code since about 2014. They've come in sort of in various ways throughout the last number of years, but it could look like basically part of the construction is that there would be a granular layer and a membrane under the slab of the home, and then a rough-in in the home. And so for the first couple of years, it came in as just a short pipe in your home. And then at about 2018, then they had added the requirement that it would be extended outside the building. So similar to this pipe where it would go completely up and out through your space to discharge out of the house. And so if your house is built in those years, you should still test to determine if it needs to have a fan added or the system finished. But it's important for us to know that the National Building Code is paying attention to this and putting in measures to try and support new homes with having as lower levels. Okay, so that's all kind of the basics of radon, and I see there are questions, but keep them coming in, and we will just go through now the program, so you know the steps that are involved in the program, and then we'll pause and answer some of your questions. Okay, so at a high level, it's really, simple steps. You're going to go in, you're going to pick up your kit. You'll get an envelope that looks a little bit like this one on the screen. Inside the envelope will be your radon test and instructions. And then you want to go home, put it in place, leave it for 100 days or that minimum 91. We talk about 100 because it's easy to remember. And we want to give you a little bit extra room to make sure you get that minimum 91 days. And then at the end of that time, there's a 1-week collection, and it does tell you the dates on your envelope, but we'll also go through that today, and you'll return the detector. And so as I had mentioned earlier, these detectors need to go back to the lab to be analyzed. And so by dropping it off at the collection place, that means we will cover the shipping for all the detectors back to the lab. If you happen to be away during the collection period, you can mail the detector back to yourself, or if you forget, you can mail it back. But by collecting it together, we save the cost of the shipping. Okay, so after you pick up that kit, we want you to take it home and set it up right away. These things are easy to forget. So go home, put it in place right away. As I mentioned, you will find inside the envelope your radon detector. It will come in clear plastic. So you just need to cut open that clear plastic package, take the detector out, and then you can put it in a room. So you're going to choose a room in your home that you spend 4 hours a day or more. So I'm going to get you to think about your home and think first about your basement. If you have a bedroom or a home office or maybe a family room in the basement where you spend 4 hours a day or more, then that's a good room for you to place the detector. If you don't use your basement that often, maybe you just store things down there or go down to do laundry, then think about the main floor of your home. And again, think about a room where you spend 4 hours a day or more, like a bedroom, a family room, a home office. We usually recommend keeping it out of the kitchen. If you have an open concept space on your main floor, then just put it in a living room space that's a little bit away from the kitchen. Just as I had mentioned before, that kitchen vent fan can sometimes have different airflows, so we just recommend having a little bit of space from that. But then think about putting the detector in the breathing zone. So you're going to place it on a table or a shelf in that range of air where you're kind of breathing the air. Now, if you have children at home and you want to just put it up a little bit higher so it's out of reach, it is not dangerous. So if they take it and play with it or shake it, there's nothing in it that could be harmful to them, but it just may, go missing. So if you put it up out of the reach, and then that's fine. Or if you have pets too, then you could put it up. You can also hang it. So often if you hang it down from the ceiling a little bit, maybe about 25 centimeters or so from the ceiling, then you can do that as well. And then it's easier to find when you go back to get it later. The other thing we recommend is that you keep it off the floor. So don't put it right down on the floor. and that you keep it away from a window. So about at least a meter away from a window. Okay, so now so you've taken it home, you've picked your room, you've set it in place. Now we need some information from you so that we can connect your serial number to your start date and your address. And so we will get you to go on to start the test and give us the date. So there are some pieces of information that are mandatory. So like I mentioned, your name and your email, your address, and the serial number of the detector. Those will be required information. And then we are doing, research as well on different housing types with this program. And so there are some optional questions. And so you'll get to a point where it'll say, do you want to answer more questions? And if you're done, you can say no. If you do want to keep going, then feel free, say yes, and then you can answer the rest of the questions. And then you can submit. It shouldn't take you very long, and that's it. And then you can enjoy the rest of the next 100 days. And then in the spring, you can drop the detector off. Now, for some of you, you will get duplicate tests. And so these are two tests in the same envelope. I mentioned earlier that the detectors we use are quite accurate. And we know that because we're always checking to make sure that they are accurate. So there's a number of different measures that we do with these detectors to check the accuracy. And one of them is we use 10% of the tests to do duplicates. So those are basically side-by-side tests. So you will get different instructions that say, please set these up side by side. And then when you go to fill in the form at the start, it will ask you for a duplicate serial number. So if you have one, then that would be where you would record it. If you don't, you can skip that box. And so we would ask that you don't share these. These aren't a bonus detector, but these are to help us just check the quality. So please set them up side by side next to each other. Okay, and then at the end, you will drop them off at the collection location, and that's it. Then the detectors will be mailed back to the lab for analysis. And then after about 6 weeks or so, you will get an email from the lab with your radon report. And so it'll look something like this, and it'll have a radon number on it. And as Anne-Marie said, in Canada, we measure radon in becquerels per meter cube. And so it'll give you your radon reading on it. And it'll also come with an interpretation sheet to help you with understanding and kind of remind you of some of the things that we've walked through today about next steps. And then after all the reports come in and we start to see them come in, then we will put together a community survey and we'll reach out to your community. So with participating in this program, your individual results are confidential just between you and the lab. But what we do is we summarize the results into a community report. And so it looks something like this, where we can track, the number of homes that were tested in a community and the percentage that were above the 200 level. Okay, so these are the locations that we have for pickup. So when you registered for a kit, you picked a location, and so we have enough detectors that have been distributed for those of you that got the email from us. So if you just recently, so if you got an email from me on Friday and then again today, then you are on the registered list. If you didn't get an email, you might want to check your spam folder. So you can search info@takeactiononradon.ca and see if it got in. But we did have a high demand for this program, and so there are still a few on the wait list, but we are able to accommodate most of the people that registered for picking up from the RDOS and the town of Oliver. Actually, Matt, I'll get you to maybe join me on this discussion, and we can talk about if there's any extra kits anywhere. So Matt, do you want to give us instructions for people joining or picking up their kit?
Yeah, certainly. So, like Pam said, there are a number of locations that were registered when that you would have chosen. Pickup starts tomorrow and runs through this week, and it also is included Monday, November 3rd next week. So there's 5 days available for pickup at the location that you picked. The RDOS received about 250 kits, and we allocated an extra 10 kits for the locations. So for folks picking up at the town of Princeton, town of Oliver, town of Osoyoos, and the RDOS main office in Penticton, we have the registration information, and there are some extra kits set aside. City of Penticton is also a registration location or a pickup spot, and that's across the street from us. So lots of things going on this week.
Perfect. Thanks, Matt. And I think we did have a couple extra kits available at the Princeton Town Hall office. Is that right?
Yes, I think so. So again, we were able to actually submit 10 extras to Princeton, to Oliver, to Osoyoos, and to the RDOS office. Yeah.
Yeah. And so if you are in one of those surrounding areas, you can let your neighbors know that if they weren't comfortable using the online registration form, they can still participate. We wanted to make sure that there was sort of some drop-in kits available for anybody that maybe wasn't comfortable signing up online. We did have a large amount of participants from Penticton, and so all the first 100 got snapped up, and then we actually have added an extra 100. But if you are in the city of Penticton, if your name is on the list to pick up, then that's great. Then you can go in this week and pick up. If not, we will, if there is any left. I have already got an email from somebody saying that they have to be out of town now, so they're not going to be able to pick up. So we will sort of email out to the wait list after this first week of pickup if there are leftovers. So for any of you who are on the list, make sure you go in and pick up the kits during this week.
Pam, there was a question for someone from Peachland. They
Uh-huh.
said they were assigned Peachland, but they don't see Peachland here on the community pickup and return.
Right. Okay. So Peachland is a separate program, and it is also providing kits. So they are welcome to go into the town office at Peachland as well. We are running a program at the same time there. We just had a different, I think Wednesday is our meeting for them.
Yeah.
Yeah. Good. Okay. And we do have, so the same locations are for the drop off, but you need to go to the one that you registered to pick it up. But when it comes to dropping it off, you can drop it off at any location. And so the drop off week will be March 2nd to 6th. And then we'll make sure that all the detectors that get dropped off in any of those locations get shipped back. But just because of the limited number to pick up, you need to go to the pickup location. And on your email, we gave you your pickup location that you registered for. So if you forgot where you registered, it should be on the email. Good. Okay. So, oh yeah, just before we get to questions, we have a contest going on. So we have a radon awareness contest called November. So we're not trying to raise money, but we are trying to raise awareness. So we're trying to encourage people to tell others about radon. So since you've learned about radon tonight, we encourage you to share that with a friend or a neighbor or family member, and then tell us about it. And you can be entered to win prizes. So you can just simply go to November. It's a play on the word November, obviously, KNOWVEMBER.ca, and enter the contest. So you can do that just by, telling somebody one fact that you've learned tonight. And then we have weekly gift cards, draws for gift cards throughout November, and then grand prizes of a KitchenAid, a paddleboard, Fitbit, and some more gift cards. So feel free to join us for that. All right, and we are super thankful for our community liaisons in the community. We work with communities all across the country, and we are so thankful for our local people that we're able to connect with and work with. And so thanks to Melissa, Matt, and Amy. And then I know they've also got teams members in their office that have already been helping us out. So thank you all. All right, so Anne-Marie, do you see some questions that we can dig into already?
I do, and I just want to also say that it's tied up at 4-4 if anybody is worried that we're not going to tell you how to play the game.
We will wrap this up in time.
In the background. So there was some questions actually about the digital monitors and their accuracy versus the monitors that we're handing out. Do you want to answer that, Pam? I'm
Yeah, that's a great
assuming the
question.
yeah, go ahead. Go
Yeah.
ahead.
So the libraries are loaning digital or electronic radon monitors, and or you can purchase them online. And CNRPP has been doing research on these electronic monitors. So you can find a list at cnrpp.ca, and then there is a red box on the website that said Consumer Report. So if you click on that, then you can see that there's a list of about 6 detectors that we've approved and said, yep, these are accurate, and like 14 that we don't approve. So there are a lot right now that are being sold on these online retailer markets that we don't recommend. They don't measure properly, so don't buy those ones. So if you are going to buy an electronic monitor, make sure you go check that list out and then just buy one that's on the list.
Perfect. There's a couple people asking about the typical minimum cost is $10,000 to $20,000. Do you want to speak to that?
Oh, okay. So yeah,
Yeah.
I'm assuming radon, reducing your radon level. Now, the cost across our country is between 3 and 5,000 to install a radon mitigation system, but it can change depending on the complexity of your home. So there is, some homes that we've, in BC where they're architecturally designed or the really large footprints, that can increase the cost of the mitigation system. In the East Coast, we have some really old, few hundred-year-old homes. Some of those can be a little bit complicated. A large crawl space also can increase the cost. So it can go up, but on average, it's about 3 to 5,000. So the grant is about 1,500, and that really was set at about a half the cost originally.
There's another question about homes having no basements. So slab on grade, just a slab on the earth, and then the house is built on top of it. Do you still have to test for radon if your home looks like that?
Yeah, we recommend that everybody test. So it can be in homes that are slab on grade. You don't have to have a basement to have radon in your home. And like I said earlier, it doesn't stay in the basement, so it does circulate. Um, Also, if you are in a mobile home, you should also test. Likely your levels will be low, but we have found some mobile homes with higher levels. The skirting that goes around the edge of the mobile unit can be really airtight. And so if that, doesn't ventilate, if the air doesn't move outside of your house before it comes in, then, the radon can go into the home as well.
So that's another question. If you have a crawl space, where is the unit installed?
Mhm.
And what if you don't have a crawl space?
Right. Okay. So if you have a crawl space, do not put the test in the crawl space. You want to put it in the area where you spend time. Now, I did have a conversation with somebody earlier today that had a unique home where they had a section of their basement where they had a workshop that was a crawl space like space. So if you're spending 4 hours a day or more in a space like that, then certainly test on a shelf. But sometimes people put the detectors in a location where they're trying to find the radon. So they'll put it in their sump pit or they'll put it in the crawl space, but don't do that. You want to test the air that you breathe. So on a table, in a bedroom, or in a home office in the space that you're living.
Someone has asked if you can repeat, Rhonda. I'm just going to put it's cnrpp.ca.
Yeah,
CNRPP.
I'll put the link in the chat right to the report here.
Yeah, thank you.
Yeah.
And someone has asked about the size of the unit. So can you just give us a ballpark of how big is the unit that would be put in?
Yeah, so I'm assuming the radon test.
No, the
Okay.
mitigation system.
Okay.
The mitigation system yeah.
Well, in case you're curious, the radon test will be about the size of my palm, but the mitigation system is a 4-inch pipe, and the fan is about a 6-inch diameter. So it's not super obtrusive into your home.
And there's a bunch of people asking they've registered, but they haven't heard a confirmation or they've been told they're on a wait list. So Matt, do you have any recommendations for people who may be wondering if there's a test for them and what they should be doing?
Yeah, certainly. So the 4 RDOS locations do have extra tests allocated at those pickup sites. I can't speak for Penticton. I know there's a wait list there. There were several hundred that registered, but like Pam said, an extra 100 kits are being allocated there. Pam, maybe you can speak to that. But I would say
Yeah.
for anybody in the RDOS, if you're going to a pickup location that you're registered for, speak with the staff there if there's any questions. We do have access to kits. I'm in the Penticton office. I can assist too. But if you have registered, then there's a kit waiting for you, and there are some extras available.
Yeah. And the pickup locations have a list of all the registered people, so they'll know who's on the list. But you should have got an email from me today and then also Friday. So if you search your spam folder from info@takeactiononradon.ca, then you can check that, or email us at that email address and we'll check the list and let you know.
And I've also just re-put the link to the radon map. It is true. I'm sorry, I cut the bottom off of the map, which is where the RDOS is. I apologize for that, but you can just click on that link in the chat, or in Google, type in BC radon map into Google Chrome and wherever else you look, and it'll just take you right to the page and you click on it.
Yeah. Good. I had a couple questions that were emailed in as well. And so one of the questions was, do we know if the Penticton and the RDOS area is known to have high radon? And so as Anne-Marie mentioned, it is an area that we see as a potential. Now, although we're mapping it and we can kind of say, oh yeah, there's higher percentage of homes in this area and then that area, we do recommend that everybody test. So there's certainly areas that we don't have data. And then there's also areas where there's only a small percentage of people that were high, but we don't know which house is that in that small percentage. So even if you're in an area that's 1% of the homes are high, we recommend that you test your home for radon so that you can determine if you are the 1% or the 99. And then if you're in a 50% area, we recommend that you test your home.
I would like to put a shout out for people who might be in this sort of Penticton Summerland area. You do have a place that takes the uranium out of the drinking water, and we don't have a lot of radon tests from that area, the sort of Falder to Summerland area. So if you live there or you know people who live there, this is a great chance to contribute to science, citizen science, by testing your home, because there is indication that there is uranium around if they're taking it out of the drinking water. So it would be helpful for us to know a bit more about what's going on in people's homes. And then the data can help us better understand where to prioritize programming.
Yeah. One question about, can you have negative radon? So everywhere has some level of radon. So even the outside air, there was historical data that showed radon outdoor levels, but I would say it ranges between 15 and 30 becquerels in Canada or so. So there will be certain level outside, but so you rarely will ever get a 0 or a negative, and you certainly won't get a negative report. But the other thing to note is that the US has a different unit and a fairly different scale. So we measure in becquerels per meter cubed, and our guideline level is 200. In the US units, it's a picocurie per liter, and the equivalent is about 5.4. So you can see if you tried to compare 200 to 5, there's quite a significant difference. So it's good just to know that if somebody's telling you something and it doesn't add up, there are different units across the border.
Yeah, they do things a bit differently. The rest of the world uses the becquerel per meter cube.
Yeah.
We'll just leave it at that.
Yeah.
Still a few more people, maybe Matt asking if it's people more convenient, can they go to Penticton? I'll just hand that back to you.
Yeah, certainly. We recognize that the rural areas are very broad, and we couldn't have a pickup location everywhere. So again, if you registered and you had a pickup location that was Princeton, that's where there's a kit set aside. But every location and the RDOS has extra kits set aside. So for Brenda asking a question, if it is more convenient to come to Penticton and she's on that wait list, on that registered list, then that's where the kit is. If you have any other questions, I would suggest either emailing Pam and the team to check about the registration, or call the RDOS office tomorrow, speak with staff, speak with me, and we can confirm. And we can get a kit to you if accessibility is a problem too. So I think again,
Yeah,
there's extra kits available for those that might need it.
That's a
perfect.
great offer, Matt.
Good.
Someone's asked about the library, like what's going on with the library program. So, for actually, BC we're killing it. In Canada, we have over 350 digital devices in the library. So they kind of look like this for people who aren't familiar with them. And these really, we call these a screening program. So it basically allows you to put it in your house. It has a digital display, and then it reads out what the radon level is. It's not as accurate as what you're getting tonight. So you kind of have the gold standard of what you're going to pick up for this program. But they are legitimate, and they are supported by the federal government and the BC Lung Foundation. And they are there for most of the year. They're not going to be there in the summertime, because you're not really supposed to test in the summer because people leave their doors and windows open, and the radon levels are different. So that is an alternative to testing, but what you have now is the most accurate thing, and it's free. So it's great that people are taking advantage of the offer to get a free test this evening.
Yeah. All right. We have a few in the Q&A. So one question is, can I test more than one home? So no, this is open to residents, so free kits, and there's limited ones available. So we ask that you just pick up one. If you have a family member or relative that wants you to help them pick up their kit and they've registered, then you can certainly do that. Or if there happen to be extra kits at some of those, like Matt's been saying, and you've got a family member that didn't register but lives in those areas, then you can help them with picking up that kit. Another question about building code. So when was the mitigation mandated for new construction? And so just to be clear, it did vary across the province. So in 2014, it came in with some just basic measures that did not reduce the radon. It just provided some basic measures to help with assisting to install a mitigation system. So it was just a rough-in pipe. And then 2018, it was only applied in some areas of the province. So not all homes in 2018 would have had the extended rough-in. And then in 2024, I'm trying to remember what year it is, 2024, that was extended across the province. So homes now that are built would have the passive system. So it may provide some level of reduction, but all of those homes still need to be tested in order to determine if they need to have the fan added. Another question about, is there an ideal rate per hour that would be a viable option for a home? So I'm assuming you mean like ventilating, bringing in fresh air, or is out mitigation the only effective means? So it does depend on your home. Typically, the most effective way to reduce the radon in the home is going to be a radon mitigation system. There are some homes that would be candidates for ventilation, but they would be really airtight homes most of the time, and they would be really low levels, just above the guideline. Most of the time, there can be a calculation of the air changes. And so an HRV is a heat recovery ventilator, and this system works to bring in fresh air and then kind of remove conditioned air. So usually it's a balanced system where it removes the same amount of inside air and brings in fresh air. And so if you can, picture if you could have like a third of the home ventilation coming in with this, then you would reduce the radon level by a third. So depending on the start level, it wouldn't be enough, but also it wouldn't be reducing it to low as possible. So that's why it's not normally the first measure that we would take. However, if you already have a HRV installed in your home, these can get out of balance. So they do have filters on them, and the filters can get clogged. And so what happens then is the air coming in, it gets blocked. So not as much air is coming in as before, but the same amount of air is being taken out of the home. And so that can actually depressure your home. So if you already have an HRV installed in the house, then we recommend that you clean and balance it, and then test again, because that may reduce your radon levels. Oh yeah, good question about what happens if we have four suites in the home. Yeah, so if you have rental suites, so typically we would recommend that you would test the downstairs suites. So when we look at a building with multiple suites, we would think about testing the ground contact floor first. So those would be the two units that I would focus on. If you are an occupant in one of the upper suites and the landlord or the occupants below don't want to test, you can certainly still test your own suite. But we do recommend that if you are the renter, that you have a conversation with your landlord. Just let them know about radon. Radon may be new to them, and let them know that you're testing and that you'll share your report with them once it's done. And then we do have some materials just to provide some education to support both landlords and tenants. We've had some other homes with, unusual systems. If there's different zones of heating, that could be another reason why. So if you've got multiple suites in a home, or you just have multiple heating zones due to renovations or whatever, sometimes you might want to have an additional test. So, you get one free here, but you can always purchase another test. Oh, I did have homes with a nanny suite. So again, if the suite is part of the main heating zone, then it's probably the same level as the rest of the home. But again, you could test in something like that.
Here's another question, Pam. What is the cost of the upkeep of a radon mitigation system?
Yeah, that's a good question. It does depend on the size of fan that's installed. And so this is another reason why it should be installed by a professional. We want it to be suited for your home, so a low as possible or small a fan as possible. But it's basically equivalent to a coffee maker. So we have a chart that I can send you. If you email me this question, then I'll send you a link to it. But if you go on cnrpp.ca and look for our fan usage chart, we do have the calculation. And basically, if you make 2 cups of coffee a day, it's about equivalent of a small radon fan.
That's a good. Here, I got another really good question from Kate. Do heat pumps affect radon levels?
Yeah. They may. There's a few different factors that could go into it, but we would recommend that you test. So any renovations, including if you install a heat pump, so if you've tested previously and now then we should test again. So it is one of the things that you don't know unless you test. Good. All right. We are getting some really great questions, but we are at the top of the hour. And so I am going to wrap it up, but I will download these questions. Anything that we missed, I will put a frequently asked question into the next email. So we are recording. So I will send out a link to the recording for anybody that wasn't able to watch live, or if you want to watch it again. And then in the email, I'll put the frequently asked questions and add some more answers to the questions. If you want to reach out to us, you can get us at info@takeactiononradon.ca and ask a question anytime. We are happy to be here for you. Oh, I will answer one quick question about being away. If you're out of your house for an extended period of time, it can impact the radon levels. We're not sure how, like it could be up really high or really low. So we do recommend testing when your house is occupied. So you may want to wait and test during the 3 months when you're in your home. And then you just need to mail the kit back to us. All right, I'll wrap it up there. Matt, thank you so much for helping us tonight and providing information. Did you have anything else that you wanted to make sure you added tonight?
No, thank you very much for organizing this.
Yeah, really appreciate all of the teams with Penticton and RDOS and Osoyoos, and really appreciate all of those that helped bring this program to the area. So thank you so much. And all of you, we really appreciate. We had great pickup. There was a lot of interest in these kits. We do want to encourage you, tell your neighbors and your friends, even if they weren't able to get a free one, they can go and purchase a kit. So they can either get a one-use kit or an electronic monitor. We do have a list on the Take Action on Radon website of places that sell them. So you can check that out and find the list there. And Anne-Marie, thank you so much again for joining me tonight. And all right, well, Have a great week, evening, everyone.
Yeah, thanks. And thanks, Matt, for taking this on. And thanks to everyone for contributing to science. Yay,
Yep.
science. And thank you